I'm Dr. Lisa, and today we're talking to people about getting tested for COVID-19. It may not be a fun experience, but it really is important to stop the spread of coronavirus and end the pandemic. Have you been tested for COVID-19? Lots of people have, but some haven't. We want to make sure people know about testing. Maybe you've seen people getting a test, but still have questions about how to get a test, how it works, or where to get one. Let's see what people have to say about testing. Why should someone get tested for COVID-19?
To keep themselves safe along with others, their peers, children, grandchildren, in your workplace.
Because it's good to know if you have it or not.
They should get tested so, so you can live longer. They say it's killing people.
And what are the symptoms of COVID-19?
High fever, a cough, chest pain is almost the same symptoms as having the flu.
Headaches, smell are the symptoms.
What about your smell? What happens?
You lose it. You can't smell.
And your sense
And
of
your
taste?
taste, you can't taste. Fever, cough, achiness, fatigue, those kind of things. Flu-like symptoms.
You almost like stop breathing, like your throat get clogged up or something. I'm like,
So the most common symptoms are cough, fever, having trouble breathing. We call it shortness of breath. But you can also lose your sense of smell and your sense of taste. Some people feel tired and weak. Some people don't have symptoms at all. What should you do if you test positive for COVID-19 or you're around someone with COVID-19?
Well, it's a good idea to have a contact tracing app on your phone.
Wow.
First of all, if you tested positive for COVID-19, you should stay in the house for at least 2 weeks.
You have to let your employer know that you have been tested positive, and your family members.
So if you're negative, are there still things you need to do to protect yourself?
Yeah, stay my distance, wash my hands, and always clean behind yourselves or wherever. You still wear your mask, wash your hands, and social distancing.
Coronavirus can come into the body through the nose or the mouth, and that's the same way it can get out when we breathe out, or when we sing, or when we're talking to someone, which is why we have to wear our mask up here.
To your nose.
Because you can also exhale it, right?
Mm-hmm.
Do you know where to go for COVID-19 testing?
Anywhere's in your area, some of the clinics, some of the hospitals are doing tests now, some of the churches.
Today we heard from a few people about testing. One of the most important things we can do to stop the spread of coronavirus is to stay away from others if we test positive. I know it can be hard or even lonely to be by yourself, but remember, if it means keeping your friends and family and community healthy, you're doing a good thing. If you are wondering if you have COVID-19 or where you can get tested for COVID-19, visit coronavirus.providence.org. There you can get same-day care using your phone or a computer. You can also find information about testing, and you can check to see if you have COVID symptoms. You can also reach out to your primary care doctor. If you're feeling isolated or alone, visit providence.org/wellness resources. There you'll find mental, physical, and community wellness resources.